the cause of the fourth heart sound? The fourth heart sound is because of the atrial systole, the atrial kick. Factors affecting stroke volume and the muscarinic receptors. This will be better understood when we will study cardiac output in the next lecture. Now, can you answer this question now? What of the following event take place in the cardiac cycle? Isovolumetric pressure, isovolumetric contraction, aortic blood pressure rising? No, it is it is not decreasing. It is the ventricular pressure that is rising, not the aortic pressure. Aortic valve open? No. Aortic valve close? No. Both of them. First heart sound? Yes, because there is AV valve ka closure. That AV valve ka closure is producing the first heart sound. So this is how you learn to correlate whatever you studied in physiology with your with your events, I mean with your physiology with your medicine. As I always tell my students that physiology is the mother of medicine, so you have to study physiology very, very nicely. Now let's summarize the heart sounds. It is very important to summarize the heart sounds because they come as short note. Moreover, when you will be studying your clinical examination of the cardiovascular system, us samay pe bhi what will happen? We'll ask you to auscultate the aortic area or the pulmonary area, or auscultate the heart sounds, and the causes are asked. What is the cause of first sound, second heart sound? At that time, you should be in a position to answer. Okay? Now, as we know that the first heart sound is caused due to closure of the AV valves. So this is the cause, that is there is closure of the AV valves, right? Now because of this closure, actually what happens, a small turbulence is also created. But even if you remember that it's because of the closure of the AV valve, it is okay. How much is the duration? The first heart sound is long and dull, like the word lub, long, dull, lub. Right? Longer duration means it is around 0.15 second. The frequency is 25 to 45 hertz, and it is heard as the word lub. What does it signify? It signifies the closure of the AV valves, and therefore it marks the beginning or the onset of ventricular systole. It marks the onset or the beginning of the ventricular systole. Anytime you can get a loud heart sound, yes, you can get a accentuated or you can get a loud S1. You can get a loud S1. For example, very important physiological condition like exercise, even with hypertension, even with hyperkinetic conditions, for example, or hyperkinetic states, for example, anemia and beriberi. Anemia and beriberi. You can also get a low or a diminished first heart sound, a diminished or a low S1, very commonly, shock. Physiologically, if the person is very obese, it becomes less. Otherwise, it can be with acute myocardial infarction. It can also be with your pericardial effusion. Pericardial effusion, right? So this is S1. Now come to your S2. That is your second heart sound. This is because, what is the cause? It is because of the closure of the semilunar valves. Right? It is because of the closure of the semilunar valves. Remember, it is short and sharp. Okay, it is short and sharp like the word duck. Short means its duration. First heart sound was 0.15. This is 0.12 seconds in duration. The frequency is more, 50 Hertz, and therefore it is sharp. Now this S2 actually means what? This means that there is end of clinical systole. There is closure, there is end of clinical systole, or there is beginning of diastole. Beginning of diastole. So the second heart sound means that there is beginning of diastole. Now the first heart sound has also got two components, like the mitral component and the tricuspid component, that is the mitral valve ka closure and the tricuspid valve ka closure, but they are never heard separately, right? They are never heard separately. But S2, if you deep inspire, okay, if you ask the patient to take a deep inspiration, you will get splitting of the second heart sound, and you can hear two different components, P2 and A2, okay, P2 and A2. So we'll write about that because that is asked as a Viva question. What is the cause of splitting of the second heart sound? So you can have two components which can be separately heard. That is AO2, which is the aortic component, and P2, that is the pulmonary component, that means the closure of the pulmonary valve. Remember, you can get a loud A2 with hypertension, okay, systemic hypertension, whereas a loud P2 with pulmonary hypertension, okay, pulmonary hypertension. Now coming to very important thing, what is the splitting? What is the splitting? It is actually a gap between the aortic and pulmonary component, okay. It is a gap between the aortic and the pulmonary component, and it is very easy to detect because they are high pitched, okay. It is very easy to detect because they are high pitched, short hai, sharp hai, and it is physiological, and you can really feel it well during deep inspiration. If you ask the person to inspire deeply, you get that. What is the mechanism of this splitting? What is the mechanism of this splitting? Now, remember that the splitting or the hearing of the splitting will be very much clearly evident if you ask the person to take a deep inspiration. Okay? So you ask the normal person to take a deep inspiration, and if you are well trained enough, then you can really hear the two components. So what happens with inspiration? सबसे पहले सोचो, जैसे आपने deep inspire किया, what will happen to the diaphragm? The diaphragm will descend. Okay, the chief muscle of inspiration, it will descend, and the venous return to the heart will increase, right? So what will happen during inspiration is that more blood is drawn into the thoracic cavity. That means the venous return to the right atrium will be increased. That means right atrium se blood will go into the right ventricle. That means the right ventricle ka ejection, that is the stroke volume of the right ventricle, will increase. That means what? That means that the duration of the right ventricle, okay, the duration of the right ventricle systole increases. है ना? So you're taking a deep inspiration, more blood is coming into the right atrium, and therefore more blood is going into the right ventricle. Therefore more time is taken by the right ventricle to get empty. That means the duration of the systole of the right ventricle is increased. That means which valve will close late? P2. So P2 is delayed slightly. So you're going to get a small gap between A2 and P2, and A2 will be preceded by P2. right? Normally or during expiration there is opposite things, okay? But during inspiration, what is taking place is that with inspiration, especially with a deep inspiration, the venous return to the right atrium is increased, the right ventricular stroke volume is increased. That means the duration of the right ventricle systole is increased. So there is a slight delay in the closure of the pulmonary valve. So A2 precedes P2. That is what is a or a gap between the two components. Okay, so because this is the right ventricle का जो stroke right ventricle का systole थोड़ा सा बढ़ गया, that means left ventricle का जो stroke volume है comparatively it is less during inspiration. So you can just remember that A2 arrives earlier. Okay, A2 arrives earlier. So during inspiration, the stroke volume of the right side of the heart is more. There is a delayed closure of the P2 component and the A2 arrives early. That is what is the splitting of the second heart sound, which is physiological during inspiration. Now, S3 heart sound, remember that S3 is not audible normally. It can be heard in children, but not normally, only in children, or it can be heard also with hyperkinetic conditions. Okay, hyperkinetic conditions, that means you can hear it well in the athlete sometimes, but not normally. No, otherwise in normal person you cannot hear it. So what is the cause of this S3? What was the cause? The cause was the first rapid filling phase. First rapid filling phase. It is 0.1 second in duration and it is low pitched. Okay, it is best heard in the mitral area. It is best heard in the mitral area. As far as the S4 is concerned, which is also called actually as an atrial sound, because it is produced due to the atrial systole. It is never heard in normal individuals. Never heard in normal individuals. Never. It is low pitched, right, due to atrial systole. And if you are hearing the fourth heart sound, like you may get it in myocardial infarction, you can get it in pulmonary hypertension, you can get it in pathological conditions of left ventricular hypertrophy, like with hypertension, not normal. When there is a left ventricular hypertrophy due to pathological conditions like hypertension, that means it actually indicates either an increase in the stiffness, or you can say a non-compliance of the ventricles. Non-compliance of the ventricles. Right? So it is never heard unless until it is pathological. If you are asked what is phonocardiogram, you may be asked what is phonocardiogram. So what is phonocardiogram? It is the recording of the heart sounds, right? It is the recording of the heart sounds. Now, let me give you one MCQ. Okay? Now, in the MCQ, which of the following phase is not depicted in the diagram of cardiac cycle? Which of the following phase is not depicted in the diagram of the cardiac cycle? Atrial systole, atrial diastole, ventricular systole, or ventricular diastole. So I showed you the Vigus diagram, I showed you the cardiac cycle, right? So the correct answer is atrial diastole. So the atria, they also repolarize, right? The atria, they also repolarize. But what happens is that the atrial repolarization is obscured by the ventricular depolarization. So it is not very very clear, and therefore the atria का जो I mean इतना होता है ना, जो atria का जो diastole, it is not depicted. Then what is the maximum pressure that is achieved by the left ventricles? So this pressure is going to be in mmHg. 120, 200, 150 or 300. Yes. So remember, it can even go up to 300, but this is abnormal. If the left ventricular pressure goes so high, it is abnormal. So there is something which is called as preload, and there is something which is called as after load. So after load, okay, this after load, whenever the after load is more,